If your feet have been burning at night, if your hands go numb when you hold a phone too long, or if you feel little pins and needles crawling across your toes for no reason at all, then this video is exactly what you need to watch today, because what I am about to share could be the missing piece your doctor never mentioned. And by the end of this video, you will understand why millions of older adults walk around every single day thinking their tingling feet are just part of getting old, when in reality, there is one nutrient deficiency that doctors overlook again and again. And it might be sitting quietly behind your discomfort right now. So stay with me, because what you learn in the next few minutes may change how you feel every single morning when you step out of bed. My name is Dr. Watsun, and today we are going to talk about something that so many people over the age of 50 experience but rarely talk about openly. That strange burning sensation in the soles of the feet, the numbness in the fingertips, the feeling like your foot fell asleep, even though you have been sitting normally, the tingling that wakes you up at 2 in the morning and makes you shake your leg just to feel it again. These are not random annoyances, these are signals your nervous system is sending you, and today we are going to talk about the nutrient connection that so many people miss. Before we go further, if you are someone who cares about your health or the health of your parents or grandparents, please consider subscribing to this channel, because every week we break down real health topics in a simple way that anyone can understand. No complicated medical language, no scare tactics. Just clear, honest information you can actually use in your daily life. Subscribing means you will never miss the next video that could help you or someone you love feel better. So tap that subscribe button right now before we continue, because trust me, you will want to come back for what we cover next week too. Now let us talk about what is actually happening inside your body when your feet or hands burn, tingle or go numb. This condition often falls under something called peripheral neuropathy, which simply means the nerves in your hands and feet are not communicating properly with your brain. Your nerves are like electrical wires running throughout your body, carrying messages back and forth. And when those wires become damaged or irritated, the signals get scrambled. So instead of feeling a normal sensation, you feel burning, tingling, prickling, or complete numbness. There are many causes of this, including diabetes, alcohol, use certain medications, and yes, nutrient deficiencies. And one nutrient in particular shows up again and again in research related to nerve health. And that nutrient is vitamin B12. Vitamin B12 plays an enormous role in maintaining the protective coating around your nerves, called the myelin sheath. Think of myelin like the plastic coating around an electrical wire. Without that coating, the wire can short-circuit or send weak and inconsistent signals when vitamin B12 levels drop too low. That protective coating can start to break down. And this is when people begin noticing burning feet, tingling hands, numbness in the toes, or even a strange sensation like walking on cotton. The frustrating part is that many people, especially older adults, do not absorb vitamin B12 as efficiently as they used to. As we age, our stomach produces less of a substance called intrinsic factor, which is needed to properly absorb B12 from food. This means even if someone eats plenty of meat, eggs, or dairy, their body may still struggle to absorb enough of this critical nutrient. Certain medications commonly prescribed to older adults can also interfere with B12 absorption, including some medications for acid reflux and long-term use of metformin for blood sugar control. This is why so many seniors unknowingly walk around with low B12 levels for years without anyone catching it, because the symptoms creep in slowly, a little tingling here, a little numbness there, and it gets brushed off as just getting older, when in reality it may be your body quietly telling you it is running low on something essential. So what are the warning signs to watch for burning or tingling sensations in the feet or hands? Especially at night, numbness that comes and goes in the fingers or toes. A feeling of pins and needles even when nothing is touching the skin balance issues, or a sense of unsteadiness while walking, fatigue that does not improve with rest, occasional memory fog, or difficulty concentrating. And in some cases, a sore or swollen tongue. If you have experienced 2 or more of these symptoms, it may be worth discussing vitamin B12 levels with your doctor through a simple blood test, because catching this early can make a real difference in how quickly nerve discomfort improves. Now, I want to be very clear. This video is not meant to replace medical advice. We are simply here to raise awareness so you can have an informed conversation with your doctor. If these symptoms sound familiar to you, please do not just brush it off or assume it is something you have to live with. The earlier a nutrient deficiency like this is caught, the better. The chances of improving nerve health and reducing that uncomfortable burning or tingling sensation. Many people find that once healthy B12 levels are restored through diet or supplementation, as guided by their doctor, the burning and tingling sensations begin to ease over time. Nerve tissue does have the ability to repair itself, but it needs the right building blocks to do so. And vitamin B12 is one of the most important ones. Foods naturally rich in B12 include eggs, fish, poultry, dairy products, and fortified cereals. However, for older adults who struggle with absorption, diet alone may not be enough, which is why doctors sometimes recommend specific supplements or in some cases injections, depending on how low the levels are and how severe the symptoms have become. It is also worth mentioning that other nutrients play a supporting role in nerve health. As well, magnesium helps regulate nerve signaling and muscle function. And low magnesium levels have also been linked to cramping, tingling, and restless legs, especially at night. Vitamin B6 and folate are also part of the same nerve health family. And when these nutrients work together, they help maintain proper communication between your brain and the rest of your body. This is why a simple blood panel checking several of these markers at once can give your doctor a much clearer picture of what might be contributing to your symptoms. I also want to touch on lifestyle factors that can make nerve symptoms worse, even if a nutrient deficiency is present. Sitting for long periods without moving can restrict blood flow to the feet and legs, making tingling and numbness more noticeable. Wearing tight shoes or socks can also compress nerves in the feet, leading to discomfort that mimics nerve damage even when the underlying cause is simply circulation-related gentle movement throughout the day. Short walks, stretching the legs and feet, and even simple ankle rotations while sitting can help keep blood flowing properly and may ease some of that uncomfortable tingling sensation. Another factor worth mentioning is blood sugar regulation, because even in people who are not diagnosed with diabetes, fluctuating blood sugar levels can affect nerve health over time. This is why maintaining a balanced diet with steady meals rather than large sugar spikes followed by crashes can be protective for your nervous system. In the long run, small consistent changes in diet and daily movement can make a meaningful difference when combined with proper nutrient levels. Information helpful, I want to encourage you again to hit that subscribe button, because we have so many more videos coming that dive into topics just like this one. Things that affect your daily comfort, your independence, and your quality of life as you age. This channel exists because so many people feel unheard when it comes to these small but frustrating symptoms. And our goal is to give you real, understandable information every single week, so you never feel alone in figuring out what your body might be trying to tell you. Let us also talk briefly about why this topic matters so much for older adults. Specifically, as we age, nerve regeneration slows down, which means catching a deficiency early is even more important. A burning or tingling sensation that might resolve quickly in a younger person could take significantly longer to improve in someone in their 60s, 70s, or 80s. This is not meant to frighten you. It is meant to encourage you to take these symptoms seriously and to advocate for yourself when speaking with your healthcare provider. So many people wait months or even years before mentioning these symptoms to their doctor, assuming it will just go away on its own. But nerve health is not something to ignore. The sooner it is addressed, the better the outcome tends to be. If you have a parent, grandparent, or older loved one who has mentioned feeling numbness or tingling in their hands or feet, please consider sharing this video with them. Sometimes the people we love do not realize how important these symptoms are until someone else brings it to their attention. You could be the reason someone finally gets the blood work done that uncovers a simple fixable deficiency. Before we wrap up today, I want to remind you that your body is always communicating with you. Burning, tingling, and numbness are not things to be feared, but they are definitely things to be paid attention to. Your nervous system depends on proper nutrition, adequate blood flow, and consistent care. And the good news is that many of the factors contributing to these symptoms are things that can be addressed once identified. Thank you so much for spending this time with me today. If this video helped you understand something new about your health, please give it a thumbs up so more people who need this information can find it. And if you have not already subscribed, now is the perfect moment to do so. Because next week, we are covering another topic that affects so many people as they age, and you will not want to miss it. This video is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease or medical condition. Please consult your physician or a qualified healthcare provider before making any changes to your diet, supplements, or treatment plan. Especially if you are currently taking medication or managing an existing health condition. Every individual is different, and only a medical professional who knows your full health history can give you guidance suited specifically to you. Thank you for watching, and we will see you in the next video.